Hello, everyone. Welcome to our bariatric interviews. I'm Susan Peacock of Bariatric Registered Dietitian Services. My interviews talk to patients, surgeons, and vital members of the healthcare team to help you make your decisions about your bariatric surgery and to also help you maintain your healthy lifestyle post-surgery. Today, we have a rare and unique opportunity that our guest brings to us. Not only is Tara a past patient of mine, she had her surgery in 2016. She also will be talking about mental health and wellness throughout her gastric sleeve surgery process, and she will share some insights from her personal journey before, during, and after her surgery. Dr. Tara Jungersen is a Florida licensed mental health counselor and completed her Ph.D. in counseling, education, and supervision at the University of Tennessee. She also has her master's in education, where she provides community counseling at University of Virginia. Dr. Tara Jungersen has quite an impressive education and background, and I will have more information about her and contact information after the interview on the site. Please let me welcome Dr. Tara Jungersen. Hello, how are you?
Hi, Susan. Thank you so much for having me.
Yes, it's a pleasure. I'm so glad. As I said in my intro, it's a great opportunity to have a healthcare professional who has the tools and insight of the bariatric patient's emotional journey, but also has taken that journey herself. How shall we begin? How about at the beginning? What made you think about your weight and wanting to lose weight? And did you try losing weight before? And what brought you to bariatric surgery? Big question.
A big question, but an important one. And especially when you talk about it being an emotional journey, I think anyone that is considering bariatric surgery or any form of a relationship with food or diet or their bodies, there's emotions attached to it. I don't think that many people would approach the possibility of surgery lightly. Because it is such a it is a process. It's a procedure, but it's a transformation, mentally, emotionally, physically, relationally. That really the waves of it just they touch so many different parts of one's life. My personal decision, of course, I. Tried through the years so many different diets, procedures, exercises, pills, diet programs, you name it.
And how much weight did you lose in that era?
How much did I lose, or how much did I lose and regain?
Well, how much did you lose and regain when you went through that? And what age were you when you started trying to lose weight on your own?
Well, I think everyone kind of goes through their weight loss or their body image differently. For myself, my issues with weight didn't start until my 20s. Okay. So I had maybe a different journey than perhaps someone who had had weight issues even as a child or adolescent. So I started, I guess, in my mid-20s and then really tried heavily in 30s, but had some medical issues which contributed to my weight gain.
Weight gain, okay. And would you mind sharing those with us? Do you think they might help other people with similar issues?
Absolutely. So a lot of my issues had related to some gynecological issues, some infertility, and personally going through 6 different rounds of IVF, which anyone who's gone through that knows not only the emotional toil, but also the hormones through that.
Oh, yes. All right. So that's a major, yes. Okay, that IVF seems to always make people gain weight, right?
Yes, absolutely. And then, of course, too, I think our different employments, different work situations. I did transition from hospital work, which was very active, going from unit to unit, to maybe more of a desk job, especially as a therapist when you sit for long periods of time. So there's so many different, I think, aspects that contribute to weight gain with that. But for me, that was
yours. Okay. And you said you went through many different situations with different diets, pills. Okay. And you lost and you gained.
Lost and gained, lost and regained, which I think is pretty common for a lot of us, but I think it's also relevant for the bariatric surgery because that the yo-yo dieting, the weight, the regain, that I couldn't and I didn't see bariatric surgery as another one of those diets, because this is not something that would permit someone to kind of like, oh, okay, I'll do this and then I'll go back to my old ways. That it definitely could not be, it wouldn't have been successful for me to have gone about it with that.
Yes, it is not just another diet. It will prevent you from going back to your old ways, but there are ways to gain weight, as we'll talk about. So we don't want to go there right now, but we will discuss that. So that's a good point. It is not just another diet. Many times patients will say, yeah, I'm going to try this because I have nothing else to do, because I've tried everything else, but it is completely different. And what made you pick the surgeon you did, and what process did you go through? How did you get your information about the bariatric surgery?
Great question. So being a researcher, I did a lot of research. I wanted someone and a system and a provider that gave the wraparound services. This is not just a go in and have the surgery and you're done. If you don't do the ancillary services, and that includes the exercise, the trainer, the dietitian, the mental health counseling, the group support, whether virtually or in person, for me, I don't think I would have been as successful as I was with it, losing actually 140 pounds.
All right. And so that is very important, because it's not just about that 2-hour surgery and you're out and you're ready to go, right?
Correct.
And as a dietitian talking to patients all over the world before and after their surgery, I see and I hear their issues. Yes, and many times we give you lots of information before the surgery, but it never sinks in, because you go, oh, I'm not there yet. You're anticipating. How does that align with you when you were sitting there getting all this information? How did you feel about it?
I was intimidated, I'm not going to lie, that my particular surgeon required that basically was not going to do it until I did 6 months of basically behavior change that prepared me for the surgery, prepared me for the mental, the cognitive, the emotional changes that were going to come, and the physical changes and the eating habit changes. So I think when I kind of woke up and said kind of no more, that I'm not going to be like this anymore. I couldn't exercise. I couldn't, without pain and all these things that brought me happiness and helped me feel better, I couldn't do because of my weight. So the fact that I had to lose on my own 10% of my body weight, I didn't quite get there before the surgery, but I was close. And that so much prepared me for the changes after the surgery. So I was already in the practice and the habit of doing it, because surgery is it changes your body. You do feel lousy for a few days. And so it's very, very difficult to start these good habits to ensure success after the surgery, because like I said, you're recovering from a surgery, and you don't feel the greatest. So to think of starting the new diet and starting your new exercise routine and starting that afterwards, I think is maybe kind of a cognitive or mental mistake some people think or make. Some.
And your insurance required you to have 6 months of consultation. Is that correct?
Correct.
Okay.
Correct.
So they know that you need to change your lifestyle. They know,
Right.
and they're purchasing for you this surgery. They want it to be worthwhile.
Exactly.
And they want
And
to
it
stay
needed
healthy.
it.
Pardon?
Yeah. I needed it. I
You
needed
needed
that wraparound support.
What
And it was,
comorbidities did you have, Tara? I'm sorry.
I'm sorry, say that again.
What comorbidities did you have? Did you have any diabetes or high blood pressure?
I did not have diabetes. I did have high blood pressure. And you know, nothing kind of diagnosed, but my body, I mean, when I would try to exercise, you know, your back hurts, your knees hurt from all that excess weight. So I was headed in a direction where I was definitely going to have more comorbidities.
Right, right. So has that been resolved with your weight loss?
Oh yeah, my back pain went away. My blood pressure is down. It's funny, when I had lab work last year, and I'm probably going to misquote the blood levels, but you have your good cholesterol and your bad cholesterol, and I guess total cholesterol is a ratio. Right. I got a flag. I got flagged on the total cholesterol. Because my good cholesterol, I guess, was so good that it caused a flag in my total cholesterol. So yeah, and they'd never seen that before. They had never seen it before.
That's great. Okay, so hopefully they know you had bariatric surgery, so that gives a plus to that. Yeah, absolutely.
And the dietary changes afterwards.
I'm sorry?
And the dietary changes afterwards.
Absolutely. And the exercise. So when you said you were intimidated, were you thinking, oh my God, I've got so much to change. I just thought that I would get this surgery and maybe make some changes, but what intimidated you that you might not be able to accomplish, or that you were afraid to look into, or what brought you to that emotion?
The intimidation, honestly, I was scared. And I'm a pretty straight shooter, so I'll say what I was scared about. I was scared, I mean, you're having 90% of a major organ removed. And I really wanted to be sure that I had to do a cost benefit analysis of the risks of any surgery against the risks of my obesity and the diabetes that was coming, and the high blood pressure and the joint pain and all those other things. So I had to take an honest look of, was I willing to take this risk? My support systems I'll be honest, were against me having the surgery. So it took me, you know, out of the same fears of, you know, what if something goes wrong? Any elective surgery, you know, there's sometimes some people that are a little more anxious. But once I did all the research, I was on all the discussion boards online, the support groups online, reading about people's journey before, during, after, way after. I did a decision to do it.
Oh, and your support systems that were against it, did that ever make you think, I'm not going to do it?
Oh, absolutely. I mean, because the support is so important, and the relationships will change. You know, once after, and I'm so pleased to say that my support systems that were against it, again, not out of any, you know, ill will or anything, but just out of concern for me and my health. They are eating their words. They are so glad that I did it. Yeah, so that's been a great transfer. It took a while because you change, your relationships change.
Absolutely.
You're going out to eat changes.
Yes, let's talk about that. Now, what big changes did you have afterwards that you were not aware of?
Mm-hmm. So I'm not gonna lie, I love to go out to eat. My husband and I love to go out to eat, and that's kind of, especially, you know, after a long day of work, that was seen as kind of the end of the work day kind of thing. And that changed for the first couple of years, after, more so the first year. Or we would go, and it was interesting that we figured out after 1 year of it that he actually gained weight because, you know, I would initially order the same thing, or not the same thing, but order an entree. And of course I couldn't finish it because you can only eat that much at first. And then he would either finish it or eat it. And so we had to learn real fast that a lot of behaviors have to change. And now to this day, he's actually lost weight. He did not have surgery, but he's lost a significant amount of weight as well. And now even when we do go out to eat, we split an appetizer or maybe 2 appetizers. So
it's a learning process about going out to eat.
Yes, absolutely.
Because we talk about sharing, but not eating 2 meals for your support system, right? Or taking it home, or getting an appetizer.
Right.
And then, go ahead.
I was going to say, also my exercise and activity changed. I lost weight so rapidly that I knew the importance of not losing muscle through this process. That, you know, your body may attack that muscle first as far as the weight loss, and your heart is a muscle. And so I was very cognizant that I did not want any long-term health problems. So the intake of protein after the surgery was so critical. The exercise, the weight, the weights. I did get a trainer for a while.
Okay.
With that.
Great. That's great. And you kept that muscle mass. And how did was the skin affected?
Yeah, the skin was at first. The first year, because you do lose weight so rapidly, that there is some skin loosening, but it went away after a year. I think part of it had to do with the age of which I did it, because I did the surgery in my early 40s. And so I think I still had a little bit of elasticity that it kind of balanced out with that.
Okay. Did you have any plastic surgery afterwards, Tara?
No, I haven't. I say yet. I don't know if I would. I think the belly area, I think, is a problem area for a lot of women, whether they've had the surgery or not.
Right. If you have children, like you mentioned, the type of skin, how long you had been heavy, and of course the exercise afterwards, because that muscle does keep the skin from sagging somewhat. Yeah.
Absolutely. And the hydration. And the hydration.
And how about moisturizing your skin? Any changes there? Did you use more moisturizer or different kinds, or did you find anything that worked for you?
I didn't really, kind of looking back on it, I think I used CeraVe back right after the surgery. I still use it. But yeah, I did moisturize the hair products, because I did lose hair.
Okay.
Well, when I say not noticeably, my hairdresser noticed it, but you would notice it by looking at me. But yeah, I used some products that would help regrow the hair.
Okay. And how much weight did you lose, Tara?
I lost at my peak. I lost 140.
Great. And how tall are you?
I am 5'8.5".
Okay, great. And your weight is steady now, or how is that working for you?
You know, that's a great question. So I'm 4 years out from my surgery, and so you have, of course, the rapid weight loss the first year, the first 10 months with that. And since then, I have kind of maintained, but except for when I decreased my exercise.
Okay.
And because I had become a runner, which of course I couldn't have run when I was so heavy, and I had become a runner. And then, you know, life happened, job change, you know, and when you, it's easy to kind of take it for granted. It's like, oh, okay, I lost the weight, and so I had a little bit of slippage over the last year.
And is that directly related to the exercise reduction that you did?
I think so. I think it was combination. There's 2 things that happen. Is I stopped the running, and so that was huge. And then I had a job change where I was back sedentary behind the desk, and that, so those two. But also, you know, you have that restriction from the surgery the first couple 3 years, and that restriction, you slowly are able to eat more. And so that behavior change, that portion limiting that the surgery provided, you have to do yourself.
Yes.
Um,
So now that's where
the
the
other,
pre-op comes in, right?
correct,
Learning how to chew,
correct.
right?
Learning
And
to not eating and consuming liquids at the same time,
right.
which can cause problems. Learning how to chew, but also the food choices. Honestly, for me personally, I was so strict with my pre-op and even my post-op with the protein and eating the correct foods,
Right.
and I don't think I let a carb cross my mouth for a year. And I would actually get sick when I would eat, you know, like a white carb or something like that. It
Okay.
hurt and it made me nauseous.
When did you
And
incorporate fruit though into your diet, or did you?
the fruit, yeah, I didn't, and which I learned at my 1 year follow-up was a mistake, that I needed to be having that fruit in there because of the GI problems, the constipation and the things like that. So I did start building in that fruit.
Okay.
Yeah.
Good, good. And so I always ask patients, what was the issue as far as in your eating plan that made you gain weight to the point where you needed to have bariatric surgery? What were your changes that you needed to make, knowing that you have a 3-ounce stomach now and you cannot
Yeah.
eat the way you did?
Honestly, for me, it was the food choice, because what I did to gain the weight was I was a carboholic. I'm not one for sweets. You know, everybody thinks it's all sweets. No, for me, it was grease and pasta and you know, all the rice and all those things that I got a taste for. So it was learning which foods to choose, and honestly, about the protein. I didn't know actually until meeting with you the importance of protein with weight loss. And so that was my biggest switch, is initially getting the 70 grams of protein a day, which is hard even with a normal size stomach, I've found, but it's even harder with a 3-ounce stomach. So I lived on those Premier protein drinks. I looked at different types of the hydrolyzed protein, the clear protein drinks, just to have a little bit of variety. But those protein drinks were just constant in my life that first year.
Okay. And so what are you eating now, Tara? Breakfast
Now,
and dinner?
yeah,
Or what is your menu program now? Now that's 4 years out.
now, yeah, I definitely focus on the protein. So whether that is the salmon or a lean cut of red meat or shrimp or chicken, but I make sure to have protein with every meal. I lots of green leafy vegetables. I have gotten a craving for spinach, which I never ate.
Iron and calcium. Good, 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 good.
Yeah, yeah, and I think your body, you know, craves what it needs. So I crave spinach. But those and I limited my carbs. I didn't let a white carb cross my lips for a long time. And
So,
so when you do incorporate it, that's when I've learned I've had to be careful.
yes. And fruit is a carb. So that's
Yes.
good for energy. And that's usually the first one we ask about incorporating or
Yeah.
drop. But now,
I'll be honest, I need to be better on that.
and now, you know, the ghrelin was cut out of your stomach, that hunger
Yeah.
hormone.
Yeah.
Are you getting hungry now?
If and when I do, I know that it's the emotional hunger, because it's not your stomach growling that it's hungry. It's an emotional thing, especially like in times of crisis or things
Sure.
like that. I'm not hungry. This is emotion talking.
And how do you handle that, Tara, when you know that and you're cognizant of that fact, right?
Yeah. Yeah, I usually when I get that, it's a clue to me that I haven't drank my water for the day.
Okay.
So I go and do that, or I make a better choice if I do go eat, that I am eating a vegetable, or whether it's a handful of berries or some olives or something like that, rather than I don't reach for the chips or anything like that. So
Okay, that's good. And do
yeah.
you miss any of those foods that you were eating before surgery?
Well, and it's interesting because now 4 years out, I can eat anything, just not as much. So I'm not gonna lie, yeah, a couple of times I have had some ruffles and, and things like that. I mean,
Sure.
I'm not perfect. I don't think anybody is.
Right.
Um, but yeah, I miss, honestly, the times I miss it, I think, is like at a big event like Thanksgiving, when it's a big family feast, and normally you want that time to kind of have a feast meal,
Right.
and you just have to have just a taste of everything, and,
Okay.
or you spread it out, and
Right.
that's the other thing.
Yeah, two things. I always mention to patients that um, you will have to change, and
Mhm.
the joy of the things to come should supersede any food that you're used to eating, right? But it's a hard
Oh, absolutely.
switch, right?
Yeah.
It's a
Oh,
hard
yeah.
switch for people because they go,
Yeah.
"Oh, when can I have my chips again?" So the cravings should go away when you balance your
Correct.
program. And also, if you follow somebody who's had
Mhm.
bariatric surgery around, or just somebody who's healthy and trim, they do eat everything. They just don't
Mhm.
eat all of everything. A little bite of this, a little bite of that, fine.
Exactly.
So you
Yeah.
can eat like a normal person, so to speak. Okay. You're going to be watching your portions and your decisions on what you're going to eat the majority of, more real food and healthy food.
Exactly.
That's
Exactly.
great.
Exactly.
Now, for the personal part, what things have
Mhm.
changed for you when you lost that weight that was
Well,
maybe dramatic, or I'm going to let you go?
yeah, everything changed. Like I said, it's an emotional, it's a cognitive, it's a physical change. People treated me differently,
And how?
and okay, there are well-meaning people, and this is what I would advise for anybody: is you have to make up your mind about how open you want to be about the fact that you've had surgery. It's not something I wanted to necessarily scream from the rooftops, but it was nothing that I was ashamed of either. But people did and just asked me, how did you do it? And so I was honest. I said, yes, I had bariatric surgery, because you can't hide it. When you lose that much weight that rapidly, you know, they know it's more than, oh, I stopped eating carbs.
A good point. You can't hide it.
Right.
What makes you say that? Because many patients say, I'm not even going to tell my husband. I've had a couple of patients say, I'm not.
Yeah.
That's going to be tough. But they don't want to reveal. So I say, you got to have something come off your tongue when they say, wow,
Mhm.
you look great. What did
Mhm.
you do? That because if,
Um,
go ahead.
Yeah, and people asked in different ways. I mean, some were just like, did you have surgery? And again, I'm just kind of a transparent person, and so I said, yes, I did. Other people would say, Tara, are you well?
Yes.
Are you okay?
Worried.
Because people thought like I had cancer or something,
Right.
that I had
Right.
lost so much weight. So you got to be prepared for that. Again, depending on how drastic of a change that you have. And some people, it's not necessarily about you, it's that they want to lose the weight themselves, and they're like, if they see somebody else be successful, they want to know, how did you do it, because they want to do it.
And when you
So
told them, all I had bariatric surgery, what
mhm.
were the responses?
I think it's similar, that similar to even my own friends and family, like, and honestly, I think there's a part of people that think that, oh, you have the gamut. You have people that are like, good for you. You made a good choice, but you know what? That's not a choice for me. But I'm really glad that it worked for you. You have other people going, oh, I would never do that. That's too drastic. And then you have people that are kind of wait and see. It's like, okay, is she going to go back? Is she going to get big again?
Right.
So you have a range.
Okay. Any jealousy amongst your friends?
Oh gosh. Well, again, I told you I'm kind of a blunt person, so I'm gonna put it out there. Your
Sure.
relationships.
That's what we want.
I was the fat friend. I was the wing woman that, instead of going from wing woman, then we go out with the friends, and now all of a sudden, people are giving me attention and stuff. Your friendships do change, but you're good friends. You work through it, you talk through it. But if people only know you as a certain way, and this is their image of you, you've got to give them time to wrap their heads around it, because you've had time, because you've been prepping for it and gone through it. But you got to give them time to get to know the new you.
Adjust.
Yeah, to
And
adjust.
did you need to lose some friends? Did you need to let go of the ones that couldn't adjust?
Yeah, I don't know, maybe I guess it's just the quality of my friendships that we've kind of worked through it. But I have changed. I've gotten my confidence back, a lot of my assertiveness back. So
That's a good thing.
sometimes it is a good thing. It is a good thing. So, some people don't like that, just period. But
Sure. Yeah. Well, if you're malleable and they like that, but you won't even know that until you change, right?
Yeah.
And then you realize that, like you said, they just like that wingman. They don't want someone piloting the ship.
Yeah.
Right? So they learn about themselves as well.
Absolutely.
Their
Absolutely.
emotions are going, wow, she's looking so good.
Yeah, it's motivating. Like I said, my husband lost weight. He saw me I got my life back. I got my mobility back. I got to go, do things I had wanted to do. I wasn't limited. I wasn't afraid to go, water skiing or snow skiing or something like that. And so it's very empowering.
Yes. And I usually tell people you probably will get a promotion or you'll change jobs because your confidence. So you did.
I did. It happened to just happened within the same year. But yes, I had a pretty major transformation at work, with a lot more responsibilities. So I think that in some ways it was good, because I didn't have time to eat after I got.
But you had the energy to take it on after the surgery. Is that pretty truthful?
Absolutely. My energy and just my positivity, and it was just, for me personally, it was just, I think part of when I had to kind of make the decision to have surgery, it's like I was just like, I was not going to go into my old age as a fat person. I wasn't going to do it. And so having that new outlook also just kind of gave me the energy and the motivation to kind of create my future the way I want it to be. So
Right. That's great. And personally, how have things changed in your family?
It's interesting, because in my family, and I think genetically, and again, everyone's different, but I think genetically, culturally, all of us kind of had a propensity for weight gain. I am from Tennessee, so definitely a lot of comfort foods with that. Yeah, my family has been very proud of me for losing the weight. Again, I did not tell most of my family until I think I told them the night before the surgery. Just
okay.
So to kind of avoid the months of
Well, and the naysayers are can be trouble. Yeah.
And so now, because it's gone so well for me, that everyone has been just very happy for me.
Rallying around. Good. Any negative outcomes from the weight loss? Would you
Some
consider negative or just big changes?
Yeah, it's just being prepared for the changes, that people do treat you differently. I went through a period, honestly, of resentment that honestly people treated me better. And I'm like, wait a minute, I'm the same person now that I was. Great. And so I went through a period of anger, actually, that I resented. I resented it. But again, kind of going through that phase, I realized that, you know, it takes people, I have to be patient with people and kind of understand that it's on some level threatening for them. So
right.
I kind of got through that.
So that's something that you learned about yourself. You didn't think you'd be angry that someone would treat you differently. Okay. Yeah. And you see the prejudice against heavy people that way.
Exactly. Like I experienced it, and it's also made me more cognizant to make sure that I don't unconsciously do it as a microaggression.
Right. And of course, as a counselor yourself, has anyone mentioned to you, why can't you just do it yourself? Why can't you just think through this? You got the tools. You know how to do this. Why don't you just lose the weight and not get the surgery?
That's a great question. You know, I think part of me is, you know, I will say in general, as mental health professionals and any helpers, you know, we're human. And just because we have the knowledge doesn't necessarily mean that we don't have, you know, sometimes our own issues or our own medical complications or other things that contribute to it. You know, I think that just remembering that humanity, that yes, I have the tools, and yes, you know, I had kind of the knowledge, but I think the most important part about being a counselor is that I knew the importance of support and reaching out, having, you know, my own counseling through the process, being in a support group. I have an online support group of the ladies that, they happen to all be ladies, but there are obviously men have the surgery too, but we all had the surgery in the same month. So every year we celebrate our surgiversary. We check in, we share tips, but having that emotional support is critical, I think.
Good.
And so, yeah, as a counselor, I kind of knew that. Because we all, you know, in our own training, have to go through our own therapy. So we know when it's important to go in for a tune-up or an oil change, so to speak.
Right. And you mentioned about your plateaus or your slight weight gain since you had your major weight loss. And do you think you're attributing that to your lack of exercise now because of your job? Okay.
Absolutely. So I stopped running, and I'm resetting to get back into that. Because the more you run or exercise, any sort of exercise, you have that metabolism that helps burn off, you know, any excess calories you eat. But also for me, like I said, I kind of let some of the bad carbs slip back in, and so I own that. I own that.
So you see how dramatic that is when you slip those in too often.
Yes.
Right. Okay, that's important. And what surprises have you gotten, if you haven't covered that already, about your weight loss that you didn't expect?
Wow. You know, this was a mixed this is a mixed answer. When I had the weight loss and I got down to a size 14, which I had never thought.
And what were you before, Tara? What size were you?
I was up to a 24.
Okay.
And I had got down to a 14, which was, you know, my goal was just to get down to a 16. I didn't think I was going to get to a 14. So I went out and I went, my friend and I, we went shopping, went out and spent a lot of money and bought a whole new wardrobe.
Yes, what fun.
I got down to size 8. So I had to.
Okay.
So I wasn't prepared for buying more sets of clothes. So I wish I had spaced out my splurge purchasing of the
Financial
clothes.
resources. So we're,
That was
so you reached your goal and then went either further down?
way further down, way
Okay.
further
Okay. So that I hear a lot. And because
down.
people are always curious, am I going to lose 80%, like they say, 70 to 80% of the
Yes.
weight that you need to lose? So you may lose that and more.
Absolutely.
Yeah.
Absolutely.
Good.
So it
Good.
was a pleasant surprise again that I honestly attribute to the exercise and the running that I was doing in that first year. That, and I think that's key for people, is don't think that like the second year or whatever that you'll do it, is do it all the first year after the surgery.
Right. Get started. We always say just walking is sufficient. And then usually
Yeah.
people want to do the weight work to see the muscle emerge after the fat is burned off.
Yeah.
So, and then they get into marathons and
Yes.
bodybuilding, and
Yes.
yeah, it's great. It's great. They just go crazy. Okay. Very good. Well, I have gotten all my questions answered. Do you have anything else to add?
I just wanted to, I guess, just to normalize the whole range of emotions and thoughts and fears and excitement and everything, that it is a journey, and just to encourage people really to reach out to support groups. There are people out there that that are there for you, and we've all kind of been through the whole gamut of it. So just to encourage people to have that support system, I think is
Yeah,
so.
I'd love to be a guest in your support system, and I
Yeah.
have, and with the technology, we can talk to everybody anytime, anywhere. So it's
Yes.
always open for that. And I do appreciate everybody watching our interview today with Dr. Jungersen. And we will be back soon with a new interview. Thank you again, Tara. Appreciate it.
Thank you so much, Sue. Take care.
Take care.